everybody. This is the Black Student Union Podcast. We have Denise Dawkins here. We have Alex. Y'all know who I am if you don't. Kelly. And we have Elena, who is also here with us. And a little bit on this. I think come a little bit. They're going to be talking about mental health and, it's mental health and lupus awareness month. So we're going to talk a little bit about that. I'll be coming in and out of the camera. But
she don't want to sit down with us.
It's not that.
She's the director.
All right, cool. So who wants to start first? We want to start with mental health, or we want to talk about lupus first? I guess you can. Since we invited you,
we should talk about lupus first.
Let's talk about it.
Well, what am I going to talk about?
Well,
did you know lupus affects
break
all
down
ages?
What it is.
Yeah.
Talk about what lupus is.
Yeah.
Lupus is an autoimmune disease, pretty much where your immune system is hyperactive and it attacks itself. That's what lupus is.
Exactly.
Okay. And how long have you been dealing with it?
9 years. I got sick when I was 12. Never got better. Got a diagnosis at 18 due to a pretty great doctor. And I'm 21 now. So about 9 years.
9 years.
Mm-hmm.
So for 9 years, you've had lupus. And how long did it take for them to diagnose it? Like, was it like
6 years for me to actually get a diagnosis and one visit with the doctor?
Up a little higher? I'm sorry. Just trying to adjust everything.
Just get my Beyonce song.
Oh my gosh, Beyonce. What's your Beyonce side, doctor?
No, but finish saying
Beyonce side.
So how did you get diagnosed again?
Really great doctor, Dr. Bacon. He's pretty cool. First visit to him, he listened to kind of my history of symptoms and how long I'd been sick, and almost right away he was, you know what, I'm 95% sure you have lupus. Let's just do this and this and that to confirm. And we confirmed, and he diagnosed me with lupus within 2 visits, which another doctor couldn't do, and told me I was making it up for attention when I was like 14. Yeah.
It's crazy.
Mm-hmm.
Yeah. And it's kind of typical because lupus, affects us people of color. We usually get it sooner and worse.
Yeah, it runs very high amongst the minority. And since the good doctor is here, you think you might be able to explain this? Like in some of the studies, does it ever give any particular reason? Is it due to the high melanin intake that are found in minorities?
I have not found that. So, and I've been doing some research, but it just we just get it. But think about it; it's an autoimmune disease.
Mm-hmm.
Who's under stress? Who's under? So you got those.
Right. Real stress.
Or
like
real
stress with darker pigmentation.
Okay. I mean, it could be, but I think it's more about stress because it's your own body like attacking you, right?
Yep. Attacking all the good stuff.
Yeah.
So can you tell us a little bit about the side effects?
Like the symptoms?
Side effects and the symptoms and side effects, because I know you also, as comfortable as much as you want to disclose. Okay. Some of the side effects of some of the medication that you have to take for lupus. Mm-hmm. And are there different types of stages? Like they're different, like
so lupus, they have different categories. There's cutaneous lupus, subacute cutaneous lupus, erythematosus, systemic lupus, and there's like 2 more. There's one neonatal, yeah. And so I'm not yet at systemic lupus. I don't have any organ involvement. So he's categorized it as subacute cutaneous lupus.
Subacute cutaneous lupus.
Yes.
Okay.
since I don't have any organ involvement. And the medication that I take now, Imuran, which they give to kidney transplant patients, is pretty much preventative. It's supposed to help keep my immune system depressed pretty much so that it doesn't keep attacking itself and involve my organs, which we do not want, but will more than likely happen in the next couple years. Mm-hmm.
So
the next couple of years?
Mm-hmm.
So it's really just kind of keeping it at bay, giving you a little bit more time for you to deal with that part of it.
Mm-hmm.
Okay, so are you highly susceptible to getting like sick?
Yes, definitely. I mean, I'd imagine if they give the same thing to kidney transplant patients that, you know, I'm taking, you know, it works pretty good to suppress your immune system. You know,
that's what it's supposed to do.
That's what it does, and it does its job.
Mm-hmm.
Yeah.
So I can catch everything. And the thing about that, you know, my mom worries about is that, you know, there's 7 of us living at home, and so they bring home something, I'm, you know, a little more likely to catch it. If I don't catch it, I don't catch it. But if I do catch it, I'm most likely gonna have it worse than anybody else in the house will have it. Mm-hmm. Because, you know, it could be a little cold, but I'll have it for weeks, or I'll go in the hospital or something because my body just can't handle it.
Yeah. Remember we were discussing a little bit earlier about people in my family having it, and I was telling you about my aunt and how we always just thought, and I hate to put it this way, but this is the wording that we used when we were kids, was like, what's wrong with her? Why does she always come off like she's something's mentally off, you know? And that's because we were kids. Like I said before, we didn't know what was going on. And you were kind of explaining to me that, yeah,
I mean, it causes. I imagine if you know, you're living just fine one day, and one day you start having a lot of pain, and that pain never goes away. And there's some days where it's really, really bad,
like chronic pain.
There's some days where it's not as bad, but it's never gone. So I'd imagine that can make you just a little bit crazy because you have all this going on with your body. Your body has a hard time balancing it. I was telling Dr. Dawkins earlier that our bodies do adjust to it. And I hate the question, what's your pain level? Because my 3 might be someone else's 10.
Right.
You know, it's really hard to gauge because you live with it and your body adjusts to it. And there's the good days and the bad days.
Right. And then if somebody comes in and takes your vital signs, like say, I'm in pain, my blood pressure, my heart rate will be up. But because you're chronic, you kind of deal with it, you've adapted to it, and you might have a normal blood pressure.
Right.
But that doesn't mean you're not hurting.
Because your pain tolerance, it like goes to like a whole nother. It puts you at a whole nother degree, a whole nother mind state.
I almost always have a normal blood pressure. It's rare that I don't. Everything's fine, looks fine on the outside with the blood pressure and my temperature and stuff. Sometimes I'll run a slight fever, but they're like, "Well, your blood pressure's not up." Yeah, but I'm in pain.
Right.
My body has just learned how to not have my blood pressure way up here,
which is a good thing, actually.
Away, yeah.
Now, do you feel that when you're in pain that are you treated properly? Or were you treated properly? I know you have a good doctor now. So you didn't have any issues with people not believing you or?
Well, yeah, I've always had that issue, even, you know, in my own family, because you never want to think about someone actually being sick. You know, especially if it's, a doctor saying there's nothing wrong with you, then
and he couldn't possibly be wrong.
Yeah,
right?
he's a doctor.
Yeah.
He's right. You know, doctors don't get it wrong.
Right, unless they're dealing with kids, and then it's just like, you may be faking it, or you might be a hypochondriac.
Yeah.
Or,
and you know, my family, you know, they thought we were hypochondriacs, me and my mom would look at me and she's like, you know, I'm sorry, I don't know how to help you. And there really wasn't anything she could do. And I would go through, especially with the air here, and when it gets really, really bad, I wear a face mask now, but before it was, I still get really bad chest inflammation, the pleurisy stuff. And I'll go to the doctor, give steroid shot. That's the only thing that helps with that. But now it's, I have this diagnosis, so I can actually kind of get treatment versus before it was, well, there's nothing wrong with you. We don't know what to do for you. Just take some Advil.
So what was the first thing you noticed when something was wrong? What was the first thing that, like, for you that triggered
that's hard.
It was like accumulation of things that happened?
I just remember being about 12 years old and getting really sick, being out of school for 14 days. And that was when the swine flu was going around. And people were dying from the swine flu. And so I got sick, and I was too sick to go to school, but not sick enough to go to the hospital. So I was just home and, homesick. And that's the first thing that I really remember, anything being the matter. And I just never really recovered from that. And it took a little while, and the doctor's like, well, I don't know why you're so fatigued and blah, blah, blah. He ended up doing an ANA test that came back positive. He said he's pretty sure I had mono. Usually that's what you associate a positive ANA test with someone, that young at least, is just having mono. And that would explain my fatigue and, some of my symptoms to a degree. And just me never getting over it. And it, took years. And I still tested, because sometimes it tests positive, sometimes it doesn't. The tests, sometimes my body's doing really well, sometimes it's not. So it's really back and forth. But that's like the first thing I remember was just getting really sick, being out of school for a while, and never really getting better.
So after you didn't get better, you felt strong enough to still go.
I had to. I was 12 years old. I had to go to school.
But you still felt like I'm not 100% back to my normal self.
I was constantly exhausted. I would come home from school. I would sleep. Sometimes I wouldn't even eat dinner. I go home, I fall asleep, and I would stay asleep till they wake me up the next day to go back to school. I would fall asleep at school. I would go lay down on break times and stuff, and I just knock out. And so I was constantly sleeping. And it was a lot. I was like, why am I sleeping so much? And so that was kind of the never really recovering from it. And I would have bone aches a lot. Like my bones would be aching. And it was like, what do you want us to do? We can't really do anything for you because you don't have a diagnosis. We don't know what to do.
What are some of the changes that you had to make as far as like career choices and different things like that? If you don't mind sharing.
Originally, since I was pretty young, I wanted to join the military. And with a diagnosis of any type like that, they won't let you join. So I couldn't join. And now I enjoy like the public safety kind of sector. So I'd like to get into law enforcement, but because of my health and the fact that it's, it's, a little tough to say, but it's going to decline as I get older. It will. And so that's going to more than likely put me out of being able to actually go into law enforcement.
Okay. Because I was thinking more like surveillance, because you got some good eyes. She do. She got some good eyes. She got some good eyes with that bird watching. But I know in like certain things, when you like suffer for certain physical ailments and certain physical things, I know it like plays heavy on a person's mental state, mental status, because with that, it comes with like treatment of medication, different types of like side effects and different things like that. Yeah.
Well, she said she found a medication that worked.
Yeah.
And she had an allergic reaction.
Yeah. The first medication they put me on was Plaquenil. I was on it for probably close to a year. I didn't really feel any better on it, so we switched. I got on sulfasalazine, and I was on it for I think around 4 months, and I felt good. It was helping my GI problems. I felt good in general. And all of a sudden, I wake up and I've got hives just
all over,
on my arms, on my chest, all over. And as the day went on, I just started getting more hives. I was having a hard time breathing, and like the next day, I took myself to the doctor, and I was like, I don't know what's going on.
Can't you see my arms?
I'm playing connect the dots, like right here.
Yeah. And they were asking me, is there anything? Have you introduced anything new? Have you done this, and that? I'm like, no, and I couldn't think of anything. It's like, I've been on this medication for 4 months. How am I gonna have an allergic reaction to it after 4 months? Mm-hmm. But I stopped that medication, and it stopped the reaction. So I found out I was allergic to sulfasalazine. Very delayed reaction.
Very delayed.
Yeah.
It took some time to work through your system, I guess. I don't know. Yeah. That's kind of strange.
I don't know. It was weird, but it happened. I just know I can't take it no more.
Yeah. And it sucks. It sucks when you find something that works, but the side effect, man, it's not like.
It's just like one of those commercials you see on TV.
My weight gain was not natural.
It was not.
No, you're supposed to say not my weight gain. You're supposed to say this glorious figure that you see before you.
This glorious figure.
Yeah.
It was not natural.
It
was. I get migraines pretty severely, and I was getting them for probably since I was like 13. And I went and saw a neurologist, and he said, you know what, lupus. It causes a lot of inflammation. What's more than likely happening, you don't really have anything actually going on with your brain, nothing abnormal. It's just that the lupus is causing inflammation on like the lining of your brain and stuff. And he put me on amitriptyline, and it worked for my migraines. But
I knew you were going to say
that. But I also gained 50 pounds over a 5-month period. And so that was 4 whole inches. I went from wanting a 30 to a 34.
Well, what happened? Why is it that?
It's just one of those possible side effects of it. It messes with your hormones.
Yeah, most of those do.
It's an antidepressant that they use to treat.
I hate to sound ignorant, but I don't know anything about it. That's why I'm like, that's interesting.
No, a lot of those like antidepressants, stuff like that, make you gain weight.
They do.
So they can't make a formula. They haven't figured it out yet, probably.
A low fat pill or something.
There's some that make you lose weight. There's some that make you gain weight. And it
just
goes back and forth. Right. But it just so happened to be the one that made me gain weight and 50 pounds.
They tell you that the medication has the same effects as marijuana, for the record. Like as far as the effects.
How does marijuana make you gain weight?
As far as
you get the munchies.
You get the munchies. you get the munchies. It's like the same thing as taking like some of the pills. Like afterwards, once the effect is wear off, all of a sudden your appetite pick up.
Well, steroids will do that too.
Oh yeah.
Yeah.
I'd rather not ever be on steroids long term. They make me feel good for
You get a little high, I think.
I don't know.
Is that how it works?
Maybe. Sometimes a little bit. Because you're feeling good, and it's not a bad thing. It's just you're feeling good,
And then when you stop them, there is a down period.
So that's why they like to taper you off. Yeah.
But I don't. Yeah, I'm not planning on taking them long term because steroids long term like that can have some pretty severe side effects, including weight gain and bloating and
weight gain, bloating, facial hair. No, this is a natural hormone imbalance.
No,
but like real talk, or you might wake up
the way you got nothing. You have nothing to contribute. Come on.
No, not as far as lupus. No.
Okay.
We can switch out in a while.
Yeah.
No problem. We'll switch out.
Yes.
Like, I'll tag you in.
Yes. All right, but okay. So why was it so important for you to talk about? I know you actually sent me a video that you had done 2 years ago when you talked about lupus.
2 years ago. It was. I mean, a lot of people don't know about it, And even some doctors, or you'll even see it like portrayed in TV shows and stuff. Oh, it's lupus. It's always lupus, and they downplay what's going on. And it's this person has lupus, but they might just be drug seeking, or because it does happen. People get addicted to painkillers. Because it makes you feel good. It stops the pain. If you're in constant pain, there's sometimes you just got to find something to help you out. And so that's something I haven't really had to deal with it too much, because I don't really like to take narcotics. But there still is always the question, like, what do you want to get treated with? How do you want to be treated? Do you want pain medication? They just give you this look, like, oh, if you say you want narcotics, we're just
drug seeking.
Yeah, you're just drug seeking. But it's just with lupus, a lot of people know the name, but they don't know the stuff that comes with it. They don't realize that it can affect anybody and everybody, no matter the age or the race.
In any part of your body.
Yeah, in any part of your body. And there's different severities of it. My friend Erin, who did the video with me, she's the one that, so I met her because she started working with my dad. And my dad, he was worried about me, and he would, kind of say, oh, my daughter's, or where's your daughter, Vic? Oh, she's not feeling good today. She has this going on. She has this. And then Erin, she's like, oh, you know what? I have lupus. And it kind of sounds like she deals with a lot of the stuff that I deal with. And I have a really good doctor, Dr. Bacon. And so she ended up talking to me, and I called my pediatrician at the time. I was like almost 18, still seeing a pediatrician. Like, hey, can you refer me over to this rheumatologist? I hear that our insurance covers it, and that he might be a good doctor for me to see. And she dealt with it pretty bad. I'm not anywhere close to that stage yet. Hopefully it doesn't happen anytime soon, because
right.
But that's actually how I ended up seeing the doctor that I see now, through her. And she's the one that I did a video with. But it's just all about awareness and wanting people to know, and not just brush you off. But also people to know that just because you can't see it doesn't mean it's not there. People find out I have lupus. Oh my God, you have lupus?
It's not contagious.
That's mainly because they don't know what the hell it is to begin with.
Yeah.
So they're like, okay, is it something I can catch? Like that's exactly what how they respond. Yeah. So when you told me, I'm like, oh, okay, because it doesn't have there's no visible look.
Yeah.
Especially for at the stage that you're at, there's not really a visible look. So when you were telling me about your story, I'm like, yeah. I got relatives in my family, and I was explaining to her, my grandmother, I think it's on my mother's side.
Yeah.
My grandmother, my aunt, and then my mother developed it after she went through this traumatic surgery, and then she ended up having it, but we didn't know.
Yeah.
Because a lot of
it goes
other things
undiagnosed a lot of the time, or it gets misdiagnosed. Or even it's misdiagnosed as lupus when it's something else.
Yeah.
Also, because it's really hard to diagnose, because there's so many different symptoms that disguise themselves as something else.
And they rotate, don't they?
Yeah.
Sometimes it's not the same thing.
Sometimes I have these symptoms. Sometimes I don't, and I won't have them for a while, or I'll never have them again. Stuff like that. But yeah, it's really just about wanting people to know that, one, you can't catch it. I'm not just gonna give it to you.
And that's why I was saying, they acting all weird. Can I hug you? Can I yes? Stop being weird.
You're not gonna break if I push you or something.
If I breathe around you, you'll be all right. It's not one of those things. And again, I don't think a lot of people know it's autoimmune disease either.
They don't.
There's lupus. Doesn't sound good.
What's that? Are you sure you really have it?
Are you right? I'm sure you've heard that. Are you sure you have it?
Yeah.
What do you mean?
You don't look sick.
You don't look sick.
That's one of the things that I think a lot of people hear. I've heard it quite a few times. You don't look sick.
What does sick look like? Right?
What does sick look like? Do I have to be?
You're a nurse, shoot. You tell us. What does sick look like?
Yeah.
Because she has a chronic disease, she's dealt with it, so that's why she doesn't look sick. And it actually, I don't like to call it you're sick. It's just a condition.
Yeah. Mm-hmm.
Yeah. So is that like is that just your term, or is that like
that's my term? My kids have asthma. When they have asthma, they're not sick. Yeah. I mean, they get sick because of the asthma, but it's a condition you have. So if you look at it as being a condition versus you being sick, then it takes you out of that victim zone too.
Yeah. Like, I'm not a victim. I deal with what I have.
And it makes it easy to cope with.
I work.
Because it's something you're going to have for the rest of your life.
I'm not trying to be on disability at 25, which I mean could happen, but that's not the goal.
No.
That's not the goal.
Do you find that it more so acts up during certain weather? Do you find it
during the cold? My arthritis acts up more, and then during the heat, during the summer, my inflammation is ridiculous.
Over the top.
Because MS is like that. They can get heat can really set. Because you have triggers. You know what your triggers are.
Some of them. I don't always pay attention.
Yeah, there's no roadmap, is there?
No.
She's like, I don't always.
And it might be this week, but it may not be the next week coming up.
Yeah, but I do know the heat affects me pretty severely, at least if I'm in it for a long time.
I have that same, and that's what I was trying to explain to one of the doctors I was seeing. I said, "There's lupus that runs in my family. I have a real problem with the heat," and I'm like, I don't know if it's connected, but people just don't listen to you. Like I just coming from like a Black person's standpoint. When you tell them that you're not feeling well, a lot of times people be like, "Oh, you're okay."
Yeah.
I knew not to say, "Hey, me and Bree from going to walk real quick in this heat real quick."
Oh yeah.
I already knew it was hot. It was hot as I don't know what.
It was hot earlier.
Yeah.
I always carry sunscreen because I get a sun rash. Like little tiny bumps.
Heat rashes.
Heat rash. Whenever I exert myself, but even just in the heat or when I'm really inflamed. My mom, she's the one that notices it most of the time. I don't really pay attention to it too much. But I get the mylar rash, the butterfly rash, and that's why lupus, the little thing is a butterfly. And so it's just, I get red. It's like a red blush, or like I have a fever or something. Just right here, super red, and if you feel it, it's usually pretty warm to the touch.
Yeah. Alex was making fun of me the other day because I had a similar mark on my face. I said, "Please don't tease me." It's like
I can't help it.
I know you can't, and all I just called you was your nickname. I said, "I know you can't help it." Bright red too.
Yeah, I couldn't help it.
And it's hard because when you're having the symptoms, you need to get in and see the doctor, but can you get in?
No.
Right. It's like hurry up and wait, and then they're like, "How can I help you?" Well, it doesn't show the signs.
It's gone already. I don't have those symptoms already, which I mean it sucks, but you can't really expect a doctor who sees a ton of other patients to see you at the drop of a hat. It's just not.
I mean, that's why you have to see specialists. I never met Dr. Bacon before, but that's why specialists are so important, because they'll be able to recognize, because they're around it all the time.
And with him, it's like, oh, what's going on? Anything new? Any new symptoms? How have you been feeling?
Yeah, because they're trying to get a report, like a chart on you, like a history of what's going on with you. To see if medication is working. Has he ever suggested, and again, as much as you want to share, has he ever suggested medication, like experimental medication to you?
No, just because we're not at that point yet. We still have options to try at this point. I'm on my third or fourth medication, immunosuppressant medication, and there's a ton of them. So if we get to the point where I'm allergic or it's not working, then we'll find something else to do at that point. But we're just not there yet.
But for right now, the combination you have they're
effective enough. Yes.
So some of the side effects that you get from it that you feel is tolerable, like you're kind of like whatever.
Yeah.
What would some of those be that you're kind of like, okay, not really a big deal?
From the medication or just
the medication?
I don't really experience too many side effects from it. I don't think, not that I could think of.
Mm-hmm.
I know when I was on Plaquenil, I had more stomach problems, more GI problems. I was more sensitive to the sun. When I was on Sulfa, I was extremely sensitive to the sun, even more so.
Oh.
So like I would walk outside and I would get a sun rash.
Yeah. Mm-hmm.
And on Imuran, I can get really sick really easy.
Hmm.
You get nauseated a lot too, right?
Oh yeah, but that's not from the medication. That's just one of my symptoms.
Yeah.
Yeah.
One of your symptoms.
I deal with a lot of nausea. I don't remember what it's called, but it's arthritis in multiple places.
Mm-hmm.
My hands, my grip strength kind of sucks. It does. I can't play my guitar for as long as I used to, you know. What else? Oh, I've got because of the inflammation and then the slight arthritis, I see my chiropractor all the time because I got stuff that like in my neck.
Great.
They turn in to each other and kind of pinch right there.
You?
They readjust. I have ribs that slip out of place. My hips move out of place. And so I just go to the chiropractor. It works pretty well.
Your chiropractor.
How often?
Yeah. But these are all like unique. Not every situation is like yours.
No two
are like.
They're all different.
Mm-hmm.
They all vary. I guess that's probably why also it's hard to.
That's why it's so hard because nobody is exactly the same. Mm-hmm. So the chiropractor, if I'm flaring, I see him once or twice a week.
Mm-hmm.
If I'm not, like I've been needing to get in to see him for like the past week and a half or something, but it's tolerable right now. But there's sometimes where it's like, oh my hip is out of place. I could feel it, and I could feel it when I walk, and I'm like, okay, I gotta go to chiropractor. So if I'm really inflamed, I see him more. So I see him a lot more during the summer than I do any other time of the year because the inflammation kind of pushes stuff out of place.
That's intense.
It is what it is.
No, that's intense. It just makes me think back to, my aunt and kind of like her whole thing and seeing how she was, and then now kind of looking at it from my perspective.
Maybe she was justifiably a little crazy.
I'm done.
We
were like little kids.
Yeah.
And as little kids, we don't know anything, so we're like,
you think they're just weird. And
what's wrong? What's going on? It was more just like for us curiosity because we couldn't put a name to it. We were just like some name right with our aunt.
Yeah.
Poor auntie.
But well,
poor kids.
You didn't know.
Right.
But
yeah.
But as I get older, I'm having those same symptoms, and I try to keep explaining to doctors like I have it in my family. So this is possibly what is happening.
So have they done any testing?
Mm-hmm.
Yeah.
Okay.
And
it's kind of like valley fever. You just got it'll
forth.
come out negative, and it's really because people don't understand tests are not 100%.
Yeah.
So.
But then again, they're not specialists.
No.
That 1%. That's
and then your blood doesn't stay like if you're anemic, you're not always anemic.
Yeah.
Sometimes your blood's normal, and it's just back and forth, the same kind of thing.
Yeah.
My mom, she was kind of late developing it. It looks like she's going to see my rheumatologist in I think next month. And we're hoping she could get a diagnosis, but she's pretty bad right now. Where she swells up like ridiculously. Her little hands, they swell up. Her knees, her feet. So obviously she has something that hopefully the rheumatologist can, you have something, let's put you on this medication. Let's see if it helps you out. But before, when I was younger and when I went to the children's hospital, well, do you have it in your family? Do you know anybody, in your family that has issues like this? Nope. And now it's like, oh yeah, my mom.
So she developed it.
But later.
Like after you, or like
she kind of, I mean, you kind of just put it off to aging and having 5 kids.
Always 2020, isn't it?
Yeah. So you don't think about it, but now that she's a lot worse than she's ever been, it's my mom has issues. That's it's kind of from her side, kind of obviously. With those issues. So now I could be, I mean, it's a little late, but doc, my mom has issues, so maybe that's.
I was reading that they were saying that there seems to be a link with like if it's in your family, but like usually on the females.
It's more females than males. Males can get it, but not.
But females have it.
They haven't they haven't. People have been trying to make the connection, but there's no scientific journals saying yes, this is definitely the
at this point they're not able to say that it's genetic. But if you talk to different people, with if they have something, usually someone they know in their family has something. And sometimes it's more than one person, but they're still not saying that it's genetic.
It's hard to do cause and effect. Is it the environment?
Especially here in Bakersfield. There's a lot of stuff going on.
Bakersfield.
Because we have agriculture and we have smog, and now they're trying to link all the pesticide with Parkinson's.
Is it linked?
Look at McFarland.
Could it also be linked? I have a quick question. Is it linked to with her age? Do you think that it's progressing faster because of her age? Possibly.
I mean, it really is hard to say because I could be, my age, and all of a sudden I get really sick, and it's flared up, and it starts progressing really fast. So I don't know if you could really say it's age, but obviously, she's getting
older. It's an autoimmune disease, and your immune system naturally goes down when
as you age.
So it makes sense that would happen.
Yeah.
Wow, so it can lay dormant for that long.
Yeah.
Or she has a different kind of arthritis.
Yeah. Or you have a different, you have RA or.
That's a good point.
Rheumatoid arthritis. You have this fibromyalgia, multiple sclerosis. That they all have similar symptoms, but it's really hard to say which one is which because they're all in the same category and they all have similar symptoms.
So is there any information you want to share with people that might be curious about whether or not should they just do the same thing you did besides just going to see a specialist?
Just
ask questions.
Ask questions. Always ask questions. You never know unless you ask. And don't take no for an answer because if I wouldn't have pushed, I still wouldn't have a diagnosis. I'd still have unexplained chronic pain. And I wouldn't be able to get help for it because I don't have a diagnosis. The times where I'm in a flare and, I'm really sick, I can't get out of bed. She's just depressed or, she's having hormone issues. She's PMSing. That's what it would be explained as. But now it's, she has lupus. She's in a flare. Just give her space. Let's give her medication. Let's help her out with her pain. Steroids, I can get I get a corticosteroid shot if I could feel really inflamed, which I do. When I feel my chest is inflamed and I'm having a difficult time breathing, it feels like something's pushing on my chest. I go get a steroid shot, and that helps me out almost right away. But without that diagnosis of lupus, I wouldn't be able to just do that just because my insurance wouldn't cover it either. But since I do have the diagnosis, my insurance is like, oh, okay, this is because of this and this and that. It's not just, she felt bad, so she went and got a whole shot.
Yeah. I'm so sorry.
Sounds like you've had good health care.
Yes.
You've been lucky, huh?
Lucky. Yeah, there's so many people that aren't as lucky as I've been. You know, that's
a
you know,
shame
one of
I
the
even
reasons.
have to say that because it should be right.
Yeah,
but it's true.
Yeah.
Mm-hmm. I'm very fortunate that my dad has the job that he has at BC, and we have such good insurance. When they switched it up and they gave him the option to get different insurance through the pool or whatever it is they did, he kept the same insurance because for me, you know, he's like, she goes to the doctor so often, you know, and it pretty much covers almost everything. It covers all my blood tests. It covers almost all my medication.
It's nice to hear.
But yeah, there's so many people that aren't as fortunate as I am, and they're sick and they can't get help for something that's not even their fault.
Yeah.
When back in March, when my depression got pretty severe. Lupus can cause depression. It causes a lot of different issues. But for me, it was like they call it lupus fog. You can't concentrate. You can't, you know, I couldn't concentrate on anything. It was just foggy in my brain. I was, my sleeping pattern was very erratic. I would either sleep 12 plus hours a day, or I would be up for 2 whole days just not able to sleep at all because there was something going on. I would lay in my bed for hours just, oh my God, I can't sleep. And then I would come to school. I can't think because I haven't slept in 2 days.
Right.
Or I can't think because I slept 15 hours and now my brain is like overtired because you slept for so long. And my insurance covered my stay in a hospital for 2 days. I didn't have any out-of-pocket charges for that except like a $20 copay. And it covered all that. It's covering the medication that they put me on. I've got to turn the paperwork for school because I wasn't doing so well. It started last semester, and I passed 1 class out of the ones that I had. School's never been difficult for me. You know, I've never really had to try, but I was trying and I was failing. And the 1 class I passed, it was with a pretty good professor. He worked with me pretty well. My finance course, and I was able to pass that one. And the other ones I failed. I was like, I can't do this. Let me concentrate on this one, the one that I know that I can pass. And I passed it. And then this semester it just got it. I thought, you know, let me try again. Let me see if I could push through. If I could come up this semester. You know, I was pretty confident that I could, but it didn't work out. And then my sleeping got really bad. You know, the sleeping for forever or not sleeping at all. And that affected me pretty severely, and I was failing my classes again. So I'm medically withdrawing from my courses. But yeah, it affects everything. It affects your daily life, your quality of life.
I know exactly.
To where it's like I'm 21. I shouldn't feel like this.
Right.
You know, my body should not be doing this. But I think one of the things that helped me is 1, having family support. And then 2, just knowing that if I let myself sink down into, oh my God, I'm sick, you know, feeling bad about myself, that I'll get worse. You know, that I won't feel as good as I can, that I won't do as much as I do. And I mean, like, if you see me, you see me walking around, I'm talking to people. I'm almost always smiling. I try. You know,
she seems to be there at the right place when I leave my keys at home or in my office.
I'm You're in the right place, at the right time.
The good doctor. I'm done.
This morning she was like, I got my keys. I put on a lanyard.
They made lanyards for people just
They sure do.
Yeah.
That's what they're there for.
Well, thank you, Lena. Thank you so much. We really do appreciate
You
you
sharing,
sharing your information.
Anytime.
With us.
Any questions?
Thank you for sending me that video you sent me. So when I watched that this morning, and just kind of thinking like, wow, you know, it really put a lot of perspective for me, and like not being in denial about my shit.
Shit happens. And you
yeah.
can't do stuff about it sometimes.
Yeah.
You know, you can't help it. It's like
sometimes you feel bad, you just gotta feel bad.
Yeah.
And then you get over it.
Yeah, just don't.
You're like, I got stuff to do. I need to get up. I need to go do it.
Pretty much.
I think the minute you don't like allow it to overtake you, that the minute you don't let it overtake you, it's like almost like getting like hit by a wave.
But that's why people are like, you don't look sick. You're always smiling. You're always doing this and that.
It's just interesting.
And I'm like,
people
why are you
associate
sweating me?
Smiling with like being healthy.
Healthy and happy.
But that's a perfect example of you don't judge a book by its cover.
Exactly.
You know, somebody's in a bad mood or something going on, or just because they're smiling doesn't mean that, you know, that maybe, you know, don't jump to conclusions.
Yeah, I try my hardest.
I'm smiling, but I'm not happy.
Okay.
I try my best not to let my personal feelings affect the way I treat other people. It's like, you ain't got nothing to do with the way that I feel. So why am I gonna be an ass to you when you don't have anything to do with that? I mean, I get moody as hell. I mean, I think everybody does. But
I get moody as hell.
There's appropriate times to let it come out. Shut up, Alex. I don't even know you.
She lying, but I love
That's
her.
the pot calling the kettle black.
All right, so let's jump into this mental health portion of it.
You might as well sit here for this.
You want to sit here for this?
Don't leave us. Don't leave us.
You don't have to if you don't want to.
I don't care.
But I'm going to scoot over.
I don't care.
Because me and Alice we kind of had to think about trauma. We talked about, we talked about trauma a little bit.
I don't have trauma.
No, right?
We talked about trauma and like the mental health.
You laugh me. You got some kind of trauma.
We didn't have a chance to talk about like the mental health aspect of what trauma. I think we talked about it a little bit.
Yeah,
but it wasn't very long when we talked about it. But who wants to delve into mental health first?
I will.
Questions. I answer questions.
Okay.
Yeah, I'll trade you. You could get in there.
Mental health. People have this negative stigma acquainted with mental health. Like if you are a mental health patient, you're somebody
like on TV.
Yeah, you're somebody like on TV.
You got mental health issues. What?
You got mental health issues.
You're gonna go crazy and kill
You're gonna
us all.
go right. You have right. It's those type of things. It's those type of things like that. It's like hide your wives, hide your kids.
Yeah.
The nutties are out and about. The nutter butters are out and about.
You said nutter butters?
The nutter butters are out and about.
Why not move it?
Because you're a perfectionist.
I don't mean to be.
I
don't mean to be.
Now we tilted.
They're so demanding. I don't even like people. I
don't. Remember we just got through talking about mood swings? Well, here's one.
There's a witness.
Yeah.
Like, I'm ashamed. I am not ashamed.
We don't know. There's nothing to be ashamed.
I'm saucy and I know.
And that's what we want to address too. There's nothing to be ashamed of.
Can you lean a little bit?
Okay. Put her more in the picture than I can. Yeah. She's the doctor.
You can scoot. If you
I'm
scoot
just the
back
patient.
and scoot over.
Just because you're the patient, you know more than you. You're very educated.
You're very educated.
And who knows better about your body than you?
So again, as much as everybody is comfortable with sharing,
can't all do it at once, huh?
You know, Alex wants to talk.
Disclaimer.
So we should just let Alex talk.
No,
as much as anybody wants to share in terms of mental health.
It's okay. We just playing.
Yes,
she meant that.
This is cathartic.
We're all mental. So
we are. Well, normal is just a setting on a dryer.
This is like Inside Out, but minority version.
The minority version.
Scottish.
mental health is actually equal across ethnicities, but it's just the same old thing. We get it the worst.
I don't think it's the same across, because when white folks commit a crime, they can say they crazy is believable. We say there's something wrong with Leroy and stuff. Oh no, there's nothing wrong with him. It's like as though certain minorities are able to have that mental health label when it's not okay for other people that
I think Dr. Dawkins meant that it affects us all the same, except for you're saying that society-wise,
yes,
it's seen as we okay, so you just need some assistance. Opposed to it coming from other groups of people, specifically Black and Latin
looking
people.
at me.
No, saying Black and Latin people. Yeah, we're seen as there's a negative stigma. There's more.
I guess I'm just lucky because I got that white last name.
I know.
Yeah, you kind of pale.
And I'm very light skinned.
But there's
I'm like glowing in the camera.
Yeah. It's the terrible lighting in here.
The lighting. It's not.
Ain't got nothing I can do with lighting. But
yeah, there is a huge stigma.
Yes. And so it's always seen as, even though nowadays, I don't know if this is like because it's more of where we live in California, but the stigma is shifting in terms of mental health. But I think it's also depending on what type of mental health we're talking about. I think there's certain ones that people are like, okay,
like
that's acceptable.
Depression versus being schizophrenic.
Right.
Or bipolar.
Right.
Or bipolar.
Like there's more like everybody's seemingly understanding about depression. Maybe because it's hitting more people than it should.
It's just stuff is more talked about now. You know, people are able to get more help than they were at one point with a lot more issues now because there's actually a better healthcare kind of, at some point. Not necessarily better, but you could go to a doctor and you can get seen. And if you just don't pay your bill, you don't pay your bill. But you can still get seen. You can still get help.
Right.
If you're having severe issues.
Yes, and I think I think depression itself is hitting more groups of people, specifically the dominant group of people. And so now it's okay to talk about depression and like, oh, it's a real issue. Yeah. It's a real thing.
It's kind of like the Me Too movement that's been happening to all of us for how long?
Yeah.
And now
but it's not till a certain kind
rich
of
actress, white actress. Now it's a big deal. So yeah.
And if you say that, it sounds insensitive, but it's not being insensitive.
It is what it is.
True. It's true. It's like it's nothing is true or nothing is validated unless you're white. White is right.
Yeah. And so that's why I'm saying certain mental health things are given a little bit more, handled with more care than others. Like you were saying, being bipolar. I know people now who will say really insensitive things about people who have bipolar schizophrenia. I've had people in my family who have it, and are, afraid to even talk about it because, again, the stigma of being labeled. And I hate to put it this way, but this is how people talk, crazy, or something's not right, Kind of how I expressed earlier, we were talking about lupus, and I was just like, with my aunt, I'm like, what's wrong with her?
Yeah.
But again, I was a kid. But people say these insensitive things as adults, and knowing there's stigmas behind it, but it's okay because it's not socially acceptable. Like, see, I'm not the only one who has the rear on.
Screenshot.
But I didn't mean to.
But as much as everybody wants to share, what stigmas fall in some of the mental health issues that you are dealing with?
You just want attention.
Yeah,
I think that's the biggest thing.
You're just being aggressive.
A little bit this way so we can see.
Yeah, you're just being aggressive.
Say it to the camera.
You're just being aggressive.
You just want attention. You're aggressive. So
or
aggressive.
There's nothing wrong with you. You look perfectly fine. This is what happens when what's wrong with you is not external, but it's internal.
Yes, and that's what Elena was saying earlier about lupus. How it's not always visible.
when it's not visible and people are like, oh, you can just there ain't nothing wrong with
Why
you.
you
Okay,
make
just suck it up.
Yeah.
Just
Suck it
brush
up.
your shoulders off.
Mhm.
You're okay.
Pull yourself up by your bootstraps.
Oh my God, I wouldn't wish my issues on my worst enemy.
Okay.
You would not be able to deal with it. I'm sorry.
I would wish it on my worst enemy.
That's
because they're my worst enemy.
That's you.
Like they're the worst of
That's
the
not
worst.
me.
They're like the most
you.
horrible thing ever.
I'm done.
Right?
I'm done.
I don't wish harm to people, okay?
It's
Unlike-
not
unlike
harm.
somebody
I'm just
else.
transferring my pain onto you.
It's not harm.
But,
It's not
yeah.
harm. It's wishful thinking.
Yeah.
Sure.
But
Well, I'll be honest. I suffer from depression and anxiety, big time. And I work with nurses, and I had a slight breakdown, and I got written up for it.
Oh,
You know, and it's like, you know, and one of them, what the scary part one of them was a nurse practitioner in mental health. You didn't recognize what was going on. You know, like, how about coming and saying, that's not like you. Are you okay? You know, and that's all.
Are you having a bad day?
Are you having we
but
have bad days.
You're given, but even though you're saying these things and you have that being diagnosed with that, you're not given the same humanity as, for example, like a white counterpart probably would have. Like, if you kidding me, I mean, people have bad days around here, and
but do you even want to admit that?
Second,
do you even want to admit that because you don't want to use it because you're afraid? And I'm still,
I'm not afraid. I'll tell people all day long, I'm human. I'm allowed humanity, and if I have a bad day and I don't feel like smiling,
I'm having a bad
I'm allowed to have a bad day. You know why? Because you're allowed to have a bad day. I can't roll up on you and be like, shouldn't you be smiling?
But you do.
The running joke.
Yes,
but
I mean, smiling.
I mean, the part that we're constantly
You
put
think
in a
I can?
position,
You know,
where
it'll be used. In my case, it'll be used against me.
Yeah,
humane.
So, mine too.
We're not given the
and
same amount of care.
women of color.
Yeah,
we're not given that of fortitude.
We're not given that.
We're not given that. We can't use that as a
You're not given the benefit of the doubt.
That part right there.
Yeah, you can't.
It's an excuse for us
because it's like, okay, you're angry off top. Off top, you're angry because let's say percentage wise, let's say 90% of the time. Let's say you come into the office, right? And 90% of the time, I'm like pleasant, right?
You had to think about it.
I'm pleasant, and then that 10%.
What's wrong with
like
you today?
once every 6 months or
once
less.
every 6 months, like, oh no,
it's like once a week maybe.
Really? Oh, she tried it, but yeah. So let's say realistically, let's say out of a month, let's say twice a month, I have a bad day. Oh, that's it. I'm the worst employee ever.
Yep.
You take too long on your lunch. The world itself has ceased doing
exactly.
God forbid if I need time. God forbid if I need me time. I need me time.
I need to sit in my car for a couple minutes and cry. Okay.
I need to get myself together.
Get myself together.
I need to get myself together.
And we, women of color here,
Mm-hmm.
we won't cry in front of anybody.
No.
But other people will, and then they get all the sympathy, and then if you say something, you're like,
you're a victim.
God.
Wait, you're a victim.
If
You're a
you
victim.
knew
You're a victim if you're going through some shit or people are messing with you.
I
You're a
don't
victim.
cry.
Really?
I never
ladies
cry.
and gents, people, they, them.
Really?
Oh, no, I'm done with you. I'm done with you.
You're a victim.
That's the.
If you feel human, like if you feel like messed up today, but you're a victim, really?
You're a victim if somebody rehashes an event and it makes you emotional. You heartless one. So anyway, if you knew how many businesses get yelled in the hallway by professors, faculty, staff workers, because we hear it, it echoes in here. You crying about how your mother-in-law don't like you, talking about,
Whatever
whatever it is.
Why are you talking about it? Yeah. No, seriously, in all seriousness.
None of your students like you, like in all
my
seriousness.
students like me. So.
Right.
I know what's talking about you guys.
I know.
Right.
Thank God I have them, because if it wasn't for them, I would have lost my mind. Long time. Yeah.
I met those students.
Right,
Really
right.
love you.
Yeah.
I mean, all that from people eavesdropping. I mean, you hear it all.
Mhm.
You hear it all or mishear it.
Or miss
Yeah.
Or mishear.
Or misunderstood something that wasn't what it was. But anyway, so
that too is a case of mental health.
So I think that I think it's interesting when different groups of people are dealing with mental health and they're not treated with the same sympathy or empathy. I always found that very perplexing because the whole idea is that we're trying to bring awareness and say that, listen, this is a normal part of life. And then sometimes, it can be, it's really to help each other. It's really to bring it out there so that you can help those people feel like they're not alone, or
that's the worst
there's
feeling
treatment,
in the world, isn't it?
Right, or there's treatment for their depression or whatever mental health thing they're experiencing or going through.
Or make them feel crazy for venting. Okay, venting is allowed in this. I'm sorry.
Venting is I think a normal part of the dealing with stress and anxiety.
It is healthy. There's no need to get paranoid because voices get loud. It happens. It is a fact of life.
But this is why I was explaining to you before. Some people are not allowed the same levels of humanity.
That's a good way of saying it.
Well, if you look at it, like I still love to go into law enforcement. We'll see what happens with that. But if I don't, it's because I don't mind talking about my issues.
Right.
I don't mind telling people, I have this and this and this wrong with me, but I deal with it just fine. I deal with stress very well, and that's why when things got a little weird, I took myself to the doctor and I was like, something's going on. I need to.
And you felt comfortable doing it.
Yeah, and I felt comfortable doing it. But with like cops and stuff, that everybody has their issues, but you're not allowed to. The minute mental health comes into play, you're seen as weak.
Weak or
crazy.
Not just weak or crazy, but as you're damaged goods.
You're abnormal. Yeah.
You're damaged goods. You're a liability. It's really what you get looked at.
You're a liability. And I'm I could probably handle more than 80% of the people that you have. I could handle more stressful situations. I mean, I almost died in a barbershop one time. I did.
I'm sorry. I want to hear that story.
Oh, you want to?
Yeah. Let's hear it after this. But it's like, there's a stigma, but you're not allowed to be seen as human, especially if you're in some kind of position like that. You being Dr. Denise.
And the only Black full-time faculty.
Or if you have a gift or a talent, or you're told information. Oh, damn, I done told this nut job this important information. Oh, great. This broad or this person is now a liability.
What with your music?
I would always get told, "Oh my God, you have such a gift. You have, you have this and this and that. Like, you're so blessed." And but it's like, the music kind of is. It's like I've got my issues, but you like to see me in a certain light because you want to enjoy my music,
right?
And if you see anything else, and it's like you just overlook it because
I think that's a great way to like. I think it's a great thing you just said. When there's something you do that's done well, and then people recognize you for that thing. Oh, you better not deviate from that thing because again, oh my gosh,
that's what
it's
you
like
do
that
well.
possession. This is possession. No, but this is possession. This is another reason why you're not treated with the same level of humanity. You're seen as like, if you deviate from anything other than what you're doing, who are you?
Yeah.
Because we deem you're good at this, and you're only supposed to be giving us this type of substance in this music, And if you deviate anything from that, anything that doesn't go within that category, you're out of place, and get back in your place.
Exactly.
So even though you'll sing, I've actually saw her sings really, really well, great. And if you were to be like, okay, one day I'm just not going to sing these particular songs anymore, and I'm going to go, oh no, I hate it. What's wrong with you? Go back to the way it was.
Hey, that was good. But you know what sounds even better? You know what sounds real great is when you sing that one song you used to sing, and that's how they get you. They don't say what you said sounds bad.
I like that other one.
But the point I'm making isn't necessarily in the song. It has to do with
her deviating.
I think she's betrayal.
Right, the deviation, but this is their way of going and getting you or trying to correct something.
But this is what I mean by you not being treated with the same level of humanity. When you're approached with that, right, and you were treated in that fashion, oh, you're telling me, well, yeah, we know this is a thing, but you aren't allowed.
Or she's having a bad day, but I'm not allowed to have a bad day.
You're not allowed to, not to the capacity that that the other person was having.
What about when it happens with your own? Like certain people
when it happens within your own community.
When it happens when it's within your own community.
I would tell you what it is.
You better fix your face.
I'm gonna tell you what it is.
You know better than that. Like
first of all, there's ignorance involved in it for people who aren't aware.
Yeah.
They aren't aware, so there's ignorance involved. But the other thing is also those people could be perpetuating the dominant society. So they're just mirroring or mimicking the things
because they too want to be the oppressor.
Yes, there's a lot of people walking around here talking about they want to like liberate people, but really you don't want to be. You just don't want to be at the bottom anymore.
Right.
So you have no problem perpetuating these systematic things.
That part right there.
That to me is what's happening here and why there's so many different stigmas. I'm going to bring this up and I hope no one gets offended. I'm going to try to frame this in a very reasonable fashion. I had done a video a while back talking about there was this black man who got shot. He was a I think he was a therapist who was working with people that were had mental health issues. And one of the guys got out of the facility. He went to look at the patient.
Oh, I kind of remember that.
Yes, I'm trying to remember what his name is. It was a black man, and I guess they thought the young man that left the facility, had some kind of a weapon. And he was on the street sitting down playing with something. They didn't know what it was, but he was like yelling and he was upset, but he wasn't upset. Like there was a lot of things.
Having an episode.
Yes, he was just he was going through a lot of different emotions. And the guy was trying to explain to the cops, and he had his hands up. He's like, "Hey,
I remember that. He's trying to explain to him that he was a patient.
Yes, he's like, "Hey, he's a patient. He works with me. I'm just trying to get him back into the facilities to make sure he's okay." And so he lays down on the ground. This is the guy who, the professional in the field, lays down on the ground, and the guy is just sitting there with his legs crossed, kind of yelling
and
at the cop, rocking back and forth, and playing with something. I wasn't quite certain what it was. To me, it seemed like a toy just watching the video, but the guy lays down, and he's laying down, and he's kind of yelling like, "Don't shoot. He's a patient, and I work with him at this facility." The cop shoots.
Cop shoots.
The cop shoots and ends up hitting the therapist, the black therapist. And even when they interviewed him when he was in the hospital, he was saying, explaining the situation. And he says to him, the cop comes and says, "I don't know why I shot you."
He said, "I just want to know why." He knows why.
And he said, "I don't know why I shot you." And
yes, I said, "You do."
And I said, and I'm reading people's comments. They're like, "Well, why in the world?" They felt so sorry for the guy that had the disability, but the guy with the disability was not harmed in any fashion. He actually didn't.
He wasn't being.
He actually didn't even know what was going on.
Yeah.
So he wasn't even cognizant of what's happening, but all this empathy was being shown to him, not to the guy who got shot, who was trying to help, and he came from the facility and was very like. No, he was a professional. He's not just a
caretaker. I know.
So he was being very reasonable with the cop, and he ended up getting shot. And so the reason I bring that up is because a lot of times when it comes to people having mental health disabilities or issues, I'm trying to use the right wording, so I don't want to offend anybody. I said, it's interesting that whenever they told that story, that the person with the mental health issue or disability was given so much sympathy when nothing actually occurred.
Right.
He didn't even know what was going on.
It was overdone because he was there.
He was almost like a shield to like block what actually happened to the black guy. And this is kind of what happens to black people who have disabilities. We don't have the ability to use that as a shield.
No.
it's seen as an excuse, but not a legitimate excuse.
Yeah.
It's like, oh, what, you can't like tough it out?
No, it's like after the fact.
But if it's anybody else,
well, this person had a disability.
I feel so bad for
you have to afford a certain amount
there's
of compassion.
a certain amount of compassion, humanity that you're given. And I thought that was interesting because nothing actually happened to that.
He wasn't phased.
No, from my understanding, when I was reading the information, I read back on that because it was a while back. He didn't even know what was going on. Not to say that I don't feel bad that he was in the situation. I was simply stating, and again, I don't want to offend anybody. I was simply stating that no harm actually came to him. The harm came to the Black professional that was trying to help. And so, if you look at it from that, we give enough humanity and space for people who have mental disabilities, or I'll just say mental disabilities, okay, or mental health issues, okay, and we do not afford that same level of compassion for everybody equally.
We don't,
and I've always wondered. I know where it comes from. My question has always been, why is it we're afraid to say that out loud? Why are we afraid to say, yes, I have this mental health issue or disability, and I'm not being treated with the same type of humanity like for other groups of people?
Yes, you are.
Why are we not allowed?
Because no one wants to be.
You are being treated fairly.
No one wants to be the bad guy.
We treat everybody the same.
No one wants to be the bad guy.
Every time I heard that one.
But I think that's not even accurate because people just have different levels of equity here that they need.
That's a good way of putting it.
So even though you might be giving them the same level of like care, which is not true, you give somebody the same level of care. Some groups deserve more equity. They need more time. They need more,
understanding, compassion,
more compassion. So,
interesting.
Have you both seen that? I mean, I'm sure both of you have experienced that. For me, I've experienced that just because people don't view mental health for. I get a lot of different weird views about me. So
for me, it's just like, okay, you're a Black woman, how I'm dressed, how I'm looking. It's either you're probably sexually assaulted, or you probably lived on the street, or just different things to equate to that. They have these preconceived notions. And I think that's what gets a lot of people on what mental health looks like and what it's supposed to behave.
Well, they think
like.
they know.
They think they do. They think they know. And, a lot of self-diagnosis comes about, or diagnosis through family. Oh, I know my family member had that. And, you might want to check on, talk about that. So, you deal with a lot of that. Like when you mentioned that, there's a such thing as PTSD, which is post-traumatic slave syndrome. People look at it like, wait, what? There's something for that too. Yes, there's something for that too.
That explains our prevalence for high blood pressure.
It does. It also explains how we treat health, how we deal with stressors, just different things. And some things, again, are hereditary, are passed on through, generational and just different things like that. Things that we've never been treated for because, again, just like we stated earlier, just like Kelly stated earlier, Dr. Dawkins stated earlier, we as Black people and people of color, Black people, Latin people, people of minorities, there can't be nothing wrong with us. There is nothing wrong with us, to the point where we don't like to even go to doctors, which is like where you get your help, like the myths and stuff.
Well, it'd be nice if I had a healthcare worker or healthcare provider that looked like me.
That too. And that plays a big part in this too. In the myth that, there's just not enough people applying for these positions. Yeah,
there is. You just don't want to hire the ones that
right. You don't. You don't want to hire the ones. You don't want to hire the ones with the real ethnic names or things like that.
And they don't like to be challenged. How dare you challenge me?
I've experienced that myself.
And it's like, Why not? I
People
mean,
don't
if
like
you're,
to be challenged.
they don't like to be challenged. Just because I have a doctorate doesn't mean I can't be challenged, and that doesn't mean I can't learn something new. I learn a lot from my students. It's a two-way street. But it's hard to admit. Like somebody says, I used to have trouble with my family. I talk loud. That's ethnic. Plus, my grandparents were deaf, and it's like I talk loud. I talk loud when I'm happy. I talk loud when I'm sad, and it's like it's like, oh, you're being bad, or you're being emotional, or you're being aggressive because you're loud. Why can't it just be me? You know. So. But it's just just treat me the way you want. But but it's hard for people to admit that, because then they'll have to look inside their self and see their own inadequacies. It's hard. Like when you try to call somebody racist. Oh, I'm not racist. Or like I told you with that young lady, and it's like you don't know what it feels to be her. You don't feel you don't know how it feels to walk on this campus and think, oh, what are they going to do to me next? Or like, I have a son in Phoenix with that crazy sheriff. Thank God he's gone. And I worry about him getting killed. So but oh no, they understand. No, you don't. I don't know what it is to have lupus, right? I don't know how it feels. So I got to give you that play. I'm not going to say, oh, well, I just know. No, you don't know how it is. You don't know how it is. And you should respect other people's space and respect that. No, I don't. But what can I do to make you feel better? What can I do if I said something? And if I tell you said something that bothered me, that doesn't mean I'm saying, okay, that was insensitive. I'm not saying that you were racist either. Right. It's just, or you're crazy. Oh yeah. We all have our little things that we don't want to admit to, that we don't want to tell the world, that the crazy things we do. Right.
And it's not.
Well, what people think is crazy, because I don't think it's crazy.
Right. And for the record, the word crazy is not even a medical term.
It is
for all you non-medical folks out there. It is a legal term.
Yeah.
The word crazy can't even be found in a medical
Well, you know what
dictionary.
crazy is doing the same thing and then thinking it's going to work, even though it's never worked every time you try to do it.
Right.
That's crazy.
That is crazy.
That's crazy. So
that way.
So anyway, sorry, I got off on a tangent.
No, I mean, what you said was valid. Because when you are dealing with certain things. When you're dealing with certain things in the mental health community, you're dealing with people that don't want to, they want the problem to go away, but they don't want to admit to what they've attributed it to. Like, okay, all right, we want all you blacks out of here. Yeah, y'all shouldn't have brought us here. It's kind of like caught up in those. It's kind of like caught up in that segment. Like, I mean, that's the kind of rationality people want to use to justify this, that, and the other. Mental health is an issue. It is a problem.
Because my normal is not your normal.
Right. It doesn't mean
my normal's wrong or your normal's wrong.
Right. I mean, that's
you
in
gotta
a
lean a
nutshell.
little forward, doctor.
Yeah, because you all the way out the frame. There you go.
There's your beautiful face. Act like we don't want to see you.
In a little. If I'm all the way in the camera, you back in.
Okay, we're both sitting here looking like two peanut M&Ms.
Well, we're gonna wrap it up. We'll probably do a part 2 about mental health, because I think it needs its own portion of it. And when we have a chance, we'll do it. But thank you everybody for watching. And we had a couple people in here watching. And then we're gonna post some of the videos on Instagram, and we'll have this on YouTube, and we'll also have it on SoundCloud if you listen back to it. Probably I'll title it part 1.
Uh-oh.
And then we'll do a part 2 where we'll have more people and actually be in a conference room.
And if you ask questions.
Yes, bring your questions.
What I also want to leave you with is, although you may have your friend or your loved one that you do go to and talk to for just to get it off your chest, but never be afraid to seek professional help in case it's not enough. Please do.
Everybody needs help, even the strongest people.
It is, but the most experienced people too, as well.
Yes.
You know what I'm saying? So.
Well, you would get help if you get a cold, right?
Yeah.
Or you have a fever.
No, they won't. No,
you have high blood pressure.
They'll be in
bad example.
Denial.
Let's say.
But real talk, this is coming from a certified one. I got papers. You know, ADD. You know, depression.
Yes.
Yeah, I hit every stair
down. The campus has resources. They also have
they do.
They have resources, and they also have information for you to get assistance from outside resources.
Yes, they do.
If they are not able to assist you, or if you can't go in and talk to somebody about things that are happening or going on with you, always seek that information. And like I said before, this will probably be like part 1, and then we'll do a part 2
no, you're
some
not
other
alone.
time.
Yeah,
yes.
You can always follow the red brick road. Follow.
If you don't know what that is, she's talking about outside of Dorothy Donahue Hall. There is an area that is, it's just a red brick road, literally. And if you go down
the red brick road
towards the parking lot, I think that's going, what is that? Is that going
Camino Mead?
Yeah, but I think that's going like, towards Science 3. But what is that specifically? Because that would be west, east. Right.
Now she's getting into these nautical terms.
South.
I'm already
lost.
Going
south, I guess. Down the red brick road. There is a health center there.
Yes, there is.
And if you just wanted to go and talk to somebody, they also have a clinic. I believe it's in the education building upstairs. But so there's resources on campus, and they also have resources that you can go to and talk to and direct you in the right direction. And that's it.
See you next time.
See you next time. See you.
We'll see if I get invited
BSU,
back.
you'll get invited back.
Follow the red brick road.
Please.
Peace out.